Hello, everybody. Welcome back to Accepting Reality. This is David alongside Jake again. Jake, how you doing tonight?
Pretty good. How are you?
Pretty good, pretty good. So we've got a wide range of topics to discuss. This will be an action-packed episode. First off, we want to start with like a personal story. So Jake, you said you had one for the to share with the podcast, so let's hear it.
Do you ever like you talk to somebody you don't know, like in public, and like 2 minutes into the conversation, you know they're crazy, like they're insane.
I have had some interactions mostly at grocery stores, believe it or not, but yes, I
Okay,
know what you're
let me
talking about.
let me tell you what happened. So I'm at work, and this lady starts talking, and she said, I don't know how old she was, 55, 60, something like that. I don't know. And she starts telling me how we started talking about the Browns game tonight and how it's not going to matter because they're not in the playoffs. So anyway, so she goes, she says something like, "Well, hey, at least we'll have Aaron Rodgers in the fall." And
Huh?
I'm like, what? What are you talking about? So I thought she was kind of joking, and I go, "Oh yeah, well, not the good one." And as I said it, I see her face hasn't changed, and I'm like, "Well, what are you talking about?" And she goes, "Yeah, I heard on the news last time I heard that he doesn't want to come back to Green Bay, so the Browns need a quarterback, so he's going to play for us in the fall." And I'm like, uh, so I got to play along, right? And I'm like, so in my head, I'm like, lady, do you really think that right now the Packers, number one seed in the NFC, are sitting there going, "Hey, Aaron, do us a favor, play your best in the next month and a half, but in the fall, you're going to be in Cleveland. Okay, you're going to play there, and the Browns are going to take you, and you're going to have fun there." Like, what do these people think? Like, they honestly think that that's like a real possibility. So I go, yeah. And then I'm sitting with this lady, and this lady goes, oh, she doesn't know anything about football. She goes, "Oh, great, that'll be good. I can't wait until we have him." And I'm like, "You people are nuts. You don't even know what you're talking about." So I'm like, "Yeah, they're sitting over in Green Bay going, okay, we're going to deal him. But for right now, everybody knows. Everybody knows.
Yep, it's a done
Everybody knows.
deal. He's going to
It's a done deal.
Cleveland.
It's
It's
absolutely
already
going to
been
happen."
signed. Yeah.
I'm like, you people.
Oh my goodness. Well, that is certainly a nice interaction. I was lucky I still had the day off work. We had the New Year's Day observed today, so I don't have to deal
Yeah,
with
yeah,
any
yeah.
crazy people like that.
Yeah, that's
Th-
nice. Okay, whatever. Okay, what are we talking about? I had to work. I had to work.
uh-huh. You had to save the healthcare community, right? You had to
That's right.
organize them. So the
Yep.
main topic I wanted to talk about, and this ties into actually something you brought up before we started recording, is that I have never thought I'd see a time in our society when so many people were just afraid. And not just afraid of the dark, not just afraid of heights, not just afraid of traveling long distances, but just afraid to do anything. And
Mhm.
it's remarkable to me. And somebody, I don't remember where I read this quote, that since COVID, we have changed our psychology so greatly that people are more afraid to live than they are of anything else. They're more afraid to go out, in public, in society, because they're so afraid of every little thing. If someone I cannot tell you how many times I've walked into a grocery store or some sort of public place and I started having a coughing fit. Either I drank too quickly or something, and people looked at me like I was carrying the Black Plague. Like it's the
Yeah, it's normal
fear
day.
mongering is
Norm,
insane.
normal day things. Um, that before people would never have even thought twice about doing now is this big ordeal. And yeah, I mean, it's do you think it's from people that like primarily, maybe I'm trying to think of how to say, like, okay, so you have people who are naturally afraid, but then you also have people who are pretty much like, "Oh, okay, I'll do whatever I want, doesn't matter what you people say to me." But then there's like a middle. I mean, it kind of seems like this has gone, it's kind of grabbed all groups, like all three. It doesn't, you could be afraid, you could be one of the most carefree people in the world, but it's grabbed everybody, which is the crazy part, because a lot of times you could see people that and their personality would, they would never be this afraid to do anything, to go out to the store, to shake somebody's hand, to talk to somebody inside, even bring them into their house. I mean, it's pretty crazy how every single person and majority of groups are falling under this fear tactic.
And truthfully, I blame all of the media because not only did the media make COVID the biggest and most frightening thing of all time, but they put out every individual story they possibly could to scare you on a personal level. I can't tell you how many articles I saw about like a 45-year-old, 50-year-old guy who had like 4 or 5 kids, or I don't even know how many, but they're like, and now look, he's gone and his wife is left to carry on the family and all of
Mm-hmm.
these horrific scenarios so they could pinpoint each individual person's worst fear. Um, Me personally, it got me at the beginning. And after a while, I
Sure.
realized every single day of this, one, isn't healthy for you. And two, it's just, it can't all be real. And you have to go back to the truth of it because when you read every single day, oh, 100,000 people died and like 400,000 people tested positive for this virus, it'll get to you. So you either have to turn off the news or you have to realize what's really going on.
Right. I mean, it kind of depends because, like I said, you have these different groups of people, but I mean, easy for me to say, but I just think after a while you'd want to just go back. You'd want to go back to as much as normal as possible. I mean, you could be carefree and still take precautions, but I mean, to me, 2 months, 3 months into this pandemic, I was pretty much done with it and just saying, okay, whatever I can do to get back to my normal, that's what I'm going to do. And for a lot of people, I mean, I heard people a year into the pandemic, they were, oh, I didn't even leave my house yet. I've been
Yep.
inside this whole time. I mean,
Uh-huh.
can't even imagine.
I could not stay confined in four walls for that amount of time without seeing friends, without seeing family, with just out doing things. It just seemed crazy to me.
Hmm.
And all of this conversation brings us to our next point that you brought up, that the CDC changed their guidelines. You want to talk on that a little bit?
Yeah. So this from the beginning of COVID, they've had these guidelines about, if you're positive, this is how long you should stay quarantined, and you should isolate yourself with symptoms, and even if you don't have symptoms. And it kind of goes along with that whole fear thing. But so they had it at 28 days, and you had to stay inside, you had to quarantine, you couldn't see anybody for 28 days. And then they kind of moved it down. I think they did 21, and then I think for the longest time it's been 10. But now they've announced that it's down to 5. So people with COVID should isolate for 5 days. And if they are symptomatic or their symptoms are resolving, they should just follow that 5 days wearing a mask when around others, blah, 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 blah. But I just think that this 5 day thing, I just think it's so convenient that they've now lowered this incubation period even more because you have hospitals all over the country, then they're short staffed and they're overrun, and ICU beds are at a minimum, and hospital non-elective surgeries are being postponed. All these people are, one, if they're in an organization where they're getting paid because they're symptomatic and they have COVID and they're positive, well, they're getting paid for that 10 days. So is it a organizational thing where they're like, listen, we don't want to keep paying for these people to be out, even though they're sick. So let's now move it down to 5 days. Because I have a hard time believing we've looked at this virus under this microscope for almost 2 years, and we've just now figured out, oh, hey, we can wait 5 days. Now it's okay to wait 5 days. And it's just the timing of it is weird. And I just think it's very convenient that when you see the National Guard is going to different states and helping out with testing and going into hospitals. But now people can go back to work only 5 days. It's not 10. 2 weeks ago, it was 10 days. Now it's 5.
Yeah,
And I
what
just think
changed in those
it's
two
very weird.
weeks? Yeah,
It's
that's the
very, very
biggest
weird.
thing.
Because let's say you and me, we work together at a hospital. Okay. We work together. You just had COVID on December 2nd, and you were out 10 days. Now you work with me, and I just had COVID, and I was tested on Friday, and it's positive. I'm coming back in 2 days. One
Yeah,
day, I'm coming back tomorrow. Now, how are you going to sit there and say, unless you're a real follower, you think the CDC is the end all? How are you going to sit there and say, that's safe? He can come back and sit next to me.
yeah,
You were just out 10 days. How
uh-huh.
come, how come you can be out 10 days and then 2 weeks later, now all of a sudden I'm out 5 days, but they still want me to wear a mask just to make sure that I'm not. infecting anybody else. I mean, how does that make sense?
It really doesn't. And truthfully, their original revision just said 5 days and then return to normal. And after some severe backlash from different media outlets and overall like American citizen reaction is then they implemented the 5 days of wearing a mask if you have to be in public or if you're not showing any symptoms. So that really makes you wonder, does the mask do anything for the symptoms? Because they said only if you're asymptomatic after 5 days, you still have to wear a mask. But originally they didn't put that in there. They didn't put that in until people started getting
Right.
upset about it. So that should make you wonder. That should make you look at it and
Well,
scratch your head.
okay. So let me ask you this: you got these people that are wearing a mask. You know, and I know that they're putting this out there because they have to save face and they have to make their recommendations so that if somebody does something, they can't come back and say, well, the CDC didn't tell me not to. But my thing is, how many people are really going to wear a mask 5 days? Like, how would you know? Right? You're in public. If you don't care, you're not going to wear one. So it, like, I would think that if the 5 days is up and you still have to wear it for 5 more days, just leave it at 10.
Yep,
Just leave it at 10
that's what I was
because then
saying.
you know people are going to at some point just follow it, right? They're not going to be like, well, you know what? I'm just going to imagine myself going isolating for 5 days, but then the next 5 days I'll just wear a mask. No one's saying that except the CDC now. So just keep it 10 days. Just keep it 10 days, then you're fine. But now they've changed it to five. Gotta wear a mask after 5 days. And it's just no one's gonna do that because people will go with COVID positive. They'll go do their thing. They don't care. Some people just don't care. They'll go infect anybody else. So it's
Yeah.
just like, what's the point? And they're just doing it just politics, just to make themselves look like they're researching and being diligent and everything.
Well, I think another big reason is that they still need to make people feel safe, even if they aren't safe. And that's what I've been saying for the longest time about all these COVID precautions is that they're not in reality, the real world, making you any safer from contracting or dying from any sort of virus, including COVID-19, but they're making you feel better. If everyone's forced to stand 6 to 10 feet apart and wear a mask, and there's plastic shields between you and the person scanning your groceries and touching the groceries, which is ironic in and of itself, you feel better even though you probably just got exposed to just as many viruses as you did before. I don't have the exact numbers, but it just seems a little illogical to me that one, we're focused on more how people feel than how people actually are. And I think that's been since the beginning with COVID. Fear makes you feel a certain way. They put in quote unquote precautions that don't do anything except make you feel better.
How far into the whole COVID thing were you? Like how long was it until you didn't think about, oh, I got to go out in public, or oh, I got to worry about this person, or this person's coughing, or this person's touching this door hand? How long was it, or were you just from the beginning like whatever?
Um, I think 1st of April 2020, I had had enough of it. They sent us
Mm-hmm.
home from where I was working in Chicago on like March 14th or March 13th, the Friday before everyone started shutting down.
Mm-hmm.
And after the 2 weeks of reading, analyzing, listening to people, I called my personal doctor who's very intelligent and he gave me some advice on what to actually do. After that, I was like, okay. And then they just started taking away right after right after right. I'm like, okay, this is not just about a virus anymore. So yeah, about 2 weeks.
Well, see, my thing is, okay, the CDC has time and time and time and time and time again made so many contradictions, made so many changes to what they're saying. Like they've gone from you don't have to wear a mask. Now you have to wear a mask. Now it's safer if you wear cloth mask. You can't wear cloth masks. You have to wear the surgical masks. Then they said N95s are the most. So, like for instance, in New York, there's a school in New York. I don't know what the school is. They made kids. They're like fourth grade. I don't know. They made them at recess stand 6 feet apart, all wear masks outside in the cold.
Yep.
So what? How does that make sense? It
You're
doesn't.
actually
So it's like
endangering them by doing
yeah.
that.
So this whole narrative, and I said this to somebody today. I said about this whole 5 day thing with the CDC. I said it's just going to be to the point that they're going to say, if you're positive with COVID-19, as long as you feel okay, even if you have symptoms, you can go to work. You can do whatever you want. Because why wouldn't I think that? They've gone from 28 days to 5 days in less than 2 years.
Uh-huh.
So it's just going to be like another sickness. It's going to be like a cold. If you have a cold, nobody sends you home if you have a cold.
Yeah,
If you want to
usually
go
they
home,
want you to work.
if you feel like even worse, if you got to go home, okay, fine. And then if you're sick for 2, 3 days in a row, you got to get a doctor's note. But they've just gone from 28 days, a whole month, to less than a week. Something's odd about that.
Yeah, I agree. More to talk about this in coming episodes, absolutely. Let's, though, right now switch gears into probably the most bizarre thing I've ever seen in the sporting world. And I have been an avid sports fan of baseball, basketball, and football since I was like 10, 11 years old. This past Sunday, the Tampa Bay Buccaneers were playing the New York Jets, and the New York Jets are one of the worst teams in the league, and Tampa Bay is contending to win another Super Bowl. So the Jets are winning 24-10, I believe the score was, and they just got the ball back, Tampa Bay Bucks. And all of a sudden, there's a big commotion going on the opposite side of the field as one of their wide receivers, Antonio Brown, stripped down to just his pants and he was completely shirtless as he is jogging and skipping and signaling to the crowd to get loud and get excited as he runs off the field into the tunnel and was cut at halftime. And then there's images that surface on social media. You should go, people, whoever's listening to this, go on Twitter or Facebook and find him. He was standing outside the stadium waiting for an Uber, dressed in a suit with a suitcase packed in hand. So Antonio Brown, one of the most outlandish NFL players, and that's saying something coming from the NFL, he basically had enough and he said, I'll leave my uniform and my pads on the sidelines and I will have a good night, because he is now out of the NFL and most people don't expect him to get re-signed. But this was so bizarre, we just had to talk about it.
Well, okay, so he says he has an ankle injury that kept him from playing. But the thing is that people were saying he needed 3 separate things. I think by the end of the season, it wasn't by the end of that game. He needed 55 yards. He needed 8 catches and 1 touchdown. In culmination between all 3 of those goals, he would have had $1 million. So he kind of just tossed that out. Not that he probably needs it, but I think the thing that's almost compares to that was, I don't know when this was, 2014, 15 maybe. Vontae Davis supposedly, was he with the Bills?
He was on the Bills, yes.
Okay, so he's on the Bills, and then he supposedly retired at halftime. Did he ever change his mind, or was that it? I can't even remember. But that's the closest thing I've ever heard of.
Admitted his retirement papers the next day.
So, does Antonio Brown have issues? Obviously. Okay, you don't run into the end zone while the game is being played.
Yes,
like the
that
game
was
is on
during
the other
game.
side
Yep.
of the field, and he's But I mean, but the thing is he's in an Uber. He's waiting for an Uber outside, so he's not totally crazy, because if he was totally crazy, he would have gone out and jumped into traffic and with just his shirt off. But so he's somehow all there, but his episodes where I don't know. But that's the other thing too, is is he talented? Yeah, he's when he wants to be, he's one of the best receivers in the game. So how many teams, if any, will look over this craziness if they think that he can help them come in, learn the system? A couple of games later, a couple weeks later, now they're in the playoffs, second round of the playoffs, he could come in, help, whatever. Teams will bypass this craziness, I think. I don't know who, just depends how badly a need is, but I think Tony Dungy on the pregame to the Sunday Night Football said it best. He goes, nobody should sign him, because then that means they're just rewarding his behavior. He's got to get help, and until he does, nobody sign him. So we'll see what happens.
Also, just a little fun tidbit to that, he released a rap song on like SoundCloud or something within 2 hours of his incident. So he had that ready to go And then he just quit and then got on his phone and said, I'm going to drop this rap single after I just blew up Twitter and broke the internet by running across a field shirtless in the
You think
middle of
he
the
had it
game.
ready? You think he had it ready, and then because he knew that if he did this, let me ask you this: you think this was planned?
Um, I don't
Because
think it
he's
was
got it
planned.
ready, and if he does something crazy, and he knows everyone's going to be talking about it, so all of a sudden, boom, he released the video.
Maybe like his plan was if it ever went south, he would release that song, and then that was just the perfect timing because the video of him is insane. He's arguing with his teammates, and the next thing you know, he's taking everything off. He threw his gloves into the stands and his undershirt he threw into the stands. I don't know who would want that, but he whipped them at some fans, and then he just started running, like you said, while the game's happening. Like the game is going on, and he's running like a deranged fan on the field into the locker room. So,
So what was the story now? Bruce Arians, the coach of the Bucks, wanted him to play,
yep.
like go into the game, but he didn't want to. And Bruce Arians said, okay, then leave. Right?
And
Is
he
that how it
left.
went?
Yes, he told him he's done. Yeah.
And now he's saying that he had an ankle injury,
Yeah.
which is why he.
He also got suspended 3 games for providing fake COVID-19 vaccine cards to NFL players. So, I mean, that you need any more records of him being just a little off. That's
how did he? How did they find out it was fake? Do we know?
I
I never
actually
looked
I
into that
don't
story.
know, but I know the NFL apparently did a full-blown investigation, all assets deployed to make sure no one got a fake vaccine card. And
Okay, that's the other thing. Uh, okay, are they looking at everybody's vaccine card, or are they just looking at him because he's a little cuckoo, and so they might think, hey, he might be up to something? That's
I
what I
think
want
it
to
was
know.
because his personal chef uh like posted as like some of their text conversations on Twitter saying, "Yeah, I got the yeah, I believe it was something like that where the
I
chef
got
had
my
something
fourth
to do with
booster.
it." Yeah, I
Oh
don't know.
my
It's
god!
crazy. But that
Hey,
this
that's coming out
crazy
soon.
what oh, the fourth booster? Oh, absolutely.
Yeah,
Yeah,
nine
absolutely.
boosters by the time.
Oh yeah, all the
Oh,
boosters. And all of this talk about a deranged NFL player leads me into the last point that I wanted to talk about was the mental health crisis that we created. It wasn't a product of times changing. It wasn't a product of technology. It was a product of policies put in by politicians that made the mental health crisis, which was already pretty bad if you took a deep dive into the numbers, they made it exponentially worse. And it's not even comparable. I do remember I believe it was May of 2020. They released a stat that said doctors writing pills for anxiety in April 2020 went up 1,000%. That's crazy. That
mm,
there is something seriously wrong there. And one of the things that I think people don't understand or don't want to understand is that we are social creatures. We are meant to be around other people, not digitally, because we tried that and we see the results now. We need to physically be with other people. That's why going to a sporting event and cheering on a team with a complete stranger is somehow satisfying to our brains. We are social creatures. And wow, this looking at the numbers for the mental health crisis is really it's crazy, but it's happened so quickly.
yeah. Well, I think too a lot of like I know somebody who was doing a report on the limited availability for college kids at campus for like psychologists and counselors and therapists and that sort of thing. And it really is. I mean, you have I don't know, let's just say a campus that has 10,000 kids. I don't know. I mean, I don't know what this really is, but 10,000 kids and they have like four counselors. And I mean, you take kids away from their home, their environment, where they're used to, and then you put them into this situation where they're so far away that they kind of have to, they've got homework, fitting in, friends, maybe sports, they've got relationships. So, I mean, they've got all this stuff going on while they're alone, no family, they got to figure things out. And you have this limited availability of resources through mental health. And you add the pandemic onto that, on
Mhm.
top of people who already had you know um, anxiety or depression before, and now all of a sudden they can't see anybody. I
Yep.
mean, that's just a way to skyrocket it. I mean, it's definitely the virtual visits and the telehealth have helped, but I mean, this small supply of providers that can give this treatment to people that need it, and like what you're talking about, I mean, it's rising and it's not stopping, that's for sure.
Here's the image I want to try to paint in people's heads. You're 10 to 12 years old. Think about how you were at 10 to 12, particularly guys, because we were way more active when we were 10 to 12 years old than we are now. Think about that. You're in school, you see your friends regularly, you have after school activities, maybe sports, maybe something else, but you have other activities where you go pursue a hobby or a passion outside of school. All of that in one day, gone. And all you have is your room, maybe a laptop that the school gave you just so you can do school online, not seeing face to face. You don't get the education that you were getting. You don't get the interaction with your friends, which I truly think there's a link between having good relationships in society and doing well. I'm obviously those exceptions to that, but I do think there's something there. All of this stuff on a young person's like 10 to 12 year on a kid's mind at once. You hear the news saying, well, if things happen the way they happen, 2.5 million Americans are going to be dead by 2021. And then you see your mom and dad, maybe they lost their job. Maybe they're not having, the best time in their marriage because of the stress and the pressure that the pandemic threw on it. And here you are, this 10 to 12-year-old kid, and you have no idea how to process all this. So you're there completely overwhelmed. Nothing is the same, up is down. And then they're like, oh, yeah, and this is not just going to be 2 weeks. We're going on 2 years. So
Mm-hmm.
I think about all that. I'm like, wow, how would I have been if I was 10 to 12 years old when this all hit? Because I was a pretty active kid. I liked to go outside. I like to hang out with friends a lot. I like to do a lot of different things. I didn't like just sitting at home doing nothing. And then they're like, you know what? You have to sit at home and do nothing because we're not going to let anything open. And if they do, we're going to arrest them and fine them. So it's just really crazy. And then people wonder why overall in the last 2 years, children's GPAs have gone down. The amount of dropouts have gone up because they're mentally a wreck and they can't focus the way you need to focus to do well in school. And I think we need to address that and realize what we're doing is not good. And before it's too late, which we may already be there. Who knows?
Yeah, I mean, take that example but apply it to somebody who is already struggling with,
Yeah.
maybe they were, I don't know, bullied and they were having self-esteem issues or whatever, and then you add this on top of that. I mean, it's just like it's really sad. And you think about that, but you also think about the kind of qualities that something like sports, being on a sports team, gives you, and then that's taken away. Plus all the people that they missed, like the seniors that couldn't do a lot of the things that seniors do
Yep.
during their senior year, and that was taken away. You can't get it back, so they just kind of lost out on that. Some kids look forward to that their whole life. They get to high school, they get to middle school, they kind of see what that is, and they can't wait till it's them. And all of a sudden, the one year that this thing comes out where it shuts everything down is your year.
Yeah.
I mean, that would be that's an adjustment, that's for sure.
I mean, most seniors, went their whole school year up until like the middle of March and then they lost it. So they were like 6 weeks away from getting to walk
Yeah.
across the stage, so to speak. And as someone, I graduated in 2019 from college, it was fun. I didn't think anything of it. I wasn't like hyped up for it. But when I got there and they called my name and I walked across the stage and I shook the president of the university's hand that I went to and I shook the athletic director's hand because I was a student athlete, it was a great feeling. It really was.
Hmm.
You feel a really big sense of accomplishment. And I don't think a digital ceremony can do the same thing for you. Goes back to what we've said throughout this last 30 minutes of recording is that digital doesn't work. It doesn't provide the same. We're social beings, but we need tactile. Our senses are all tactile based. We look to see a 3D person. We feel things with our hands, stuff like that, that digital just doesn't give you.
Yeah, it's a band-aid. it
Yes.
it just it covers, but it doesn't actually fix the issue. So um but we'll see. I mean, boy, I mean, I remember saying at the beginning of COVID that It'll last a few months when
Hmm.
it gets warmer outside. But now we're going on 2 years, so who knows what it's going to be like. But
We took
um,
bets. I don't know if you remember that. Me, you, and a few friends, we all said, you said by like July. I said I wasn't going away till November because of the political implications. I can't remember what a few of our friends said, but I remember. And then it's like we went through all of 2021 with the same old song and dance.
yeah,
So
yeah, it got a little better over the summer when the vaccine, was out for 6 months. But I mean, again, going to my first thing with the CDC is I just the longer this vaccine's been out, the more cases have been. The surge is supposedly happening, and in terms of Ohio hospitals, where I am, this is worse than it was at the height of the pandemic last year.
that's not good.
So how is it possible when 70-80% of Ohio has been vaccinated? I mean, how is that? There is no possible way that the small, minute amount of people that have not gotten the vaccine are responsible for this surge. It's absolutely, and I actually came across somebody today. They had COVID in April, got vaccinated, boosted after that, and we're now positive again. Okay,
Wow.
so we hear about, if you have COVID, if you had it and you're vaccinated, you have these antibodies that are 20,000 times more effective. Unless she's just really unlucky, how is that possible?
You're right.
If this
Yeah.
vaccine is supposedly supposed to work, and that's not just one out of a million. There's a good number of people, more people than there should be, is my point, that are in that same boat, that have had COVID twice, they've been vaccinated, and now all of a sudden they're on their second turn. And maybe it'll just be something like the flu. Some people will just get it every year. But then if that's the case, what's the point of putting yourself at risk by getting the 27th booster made by a company that made $74 billion last year? What's the risk?
Yeah, that's I remember reading a few things that it should just be a risk assessment for each person, and most people who are young and in good health, they should be able to refuse it because risk-wise, COVID has not posed that big of a risk, and none of these mutations have either. It's just, as you had said, delaying the inevitable. We're going in circles with the mandates and the unvaccinated and all this stuff. And really, I think that it's trying, or the people responsible for the rhetoric and such are trying to keep their political opposition on the edge, so to speak. That
Mm-hmm.
as long as they keep the pressure on, so to speak, with the vaccine mandates and such, then they are on the offensive. And it's always good to be on the offensive rather than being reactive and playing defense. And when you have a situation like it is where each state pretty much aligns with one party based on the governor, and that governor enforces the party's agenda, it goes both ways. Florida and
Mm-hmm.
Texas, wide open. Illinois, New York, California. Illinois still has a mask mandate in. Okay, we have had a mask mandate since like June of 2020 with a little break in like July of 2021. So like
Mm-hmm.
almost the last 2 full years, businesses have to have signs up or they get fined. So I just think it's more political now than anything. And that's sad because it is still a sickness. I've had it, you've had it, everyone I know has had it. So it's not like it doesn't exist and it's just a game. It's actual virus. But now I really think most people are just using it for political gain.
Yeah, I just can't believe the amount of people that have just forgotten that when the vaccine first came out, it was all about that was going to prevent you from getting COVID. And somehow they've just morphed it. They've done a great job at morphing it into, well, it now helps your symptoms if you have COVID. It lessens your symptoms. And all these people that say, you hear about these yo-yos in the media that talk about, well, I'm positive for COVID because we want to know. Apparently, I want to know how the Saturday anchor on CNN is doing, or the Sunday 4 a.m. host on MSNBC. I want to know if they have COVID because I that makes me feel warm and fuzzy inside. But they'll tell you, I have COVID and I was vaccinated, but I know that if I didn't get vaccinated, I'd be a lot worse. No,
Yeah,
you're a dummy. You're a
I
dummy. No, you don't. You don't know that. So stop saying
well, that's their agenda. That's the political thing. They have to say that. If they don't, the people that support them will be like, what do you mean? You know, they will come after them like ferociously. And I don't mean
Yep.
physically ferociously. I just mean angry words on Twitter or Facebook or wherever they like to post on social media. But yeah, it's pretty crazy. To summarize everything we talked about, COVID has caused a lot of problems. I don't think they caused Antonio Brown's problems, but it's caused a lot of problems just outside of people getting sick.
Did he get
Any
boosted?
He said he got boosted. He actually, this man, we could do a whole week on this guy. He said he would take his third booster on live TV to prove to everybody that he is for the vaccine and he is not lying about using a fake card. Like, because people want, like you said, people want to tune in to watch a football player who essentially doesn't add anything to society. He's just there to entertain, get a booster shot on live TV. But just to show you, this guy's another level of crazy.
I think he was at home and he made a homemade booster. I think he
Ooh,
did some turpentine and some banana peels and injected himself. And I think that may have
sounds like
caused the deep end on Sunday.
a Tom and Jerry cartoon concoction.
I don't know. But I don't know. We'll see if we hear from him, but I doubt it. So well, I
Yeah.
don't know if this. It's crazy. That's for sure.
Yeah. Well, I think this is a good time to wrap up. Again, this is David. I was alongside Jake the entire time. God bless everybody, and we'll see you in the next episode.